Here's a clinical vignette in Puerto Rico medical revalidation style, focused on Gaucher disease, covering clinical presentation, pathology, diagnosis, and treatment. Clinical vignette, Gaucher disease. A 6-year-old boy is brought to the pediatric clinic due to increasing abdominal distension and easy bruising. His mother reports that he's been unusually tired and has had several nosebleeds over the past month. On examination, he appears pale and has massive splenomegaly and hepatomegaly. X-rays of the femur show Erlenmeyer flask deformity. Laboratory results show anemia, thrombocytopenia, and mildly elevated liver enzymes. Bone marrow biopsy reveals lipid-laden macrophages with a crumpled tissue paper appearance. There is no family history of similar symptoms, but the patient is of Ashkenazi Jewish descent. What is the most likely diagnosis? A. Niemann-Pick disease. B. Acute lymphoblastic leukemia. C. Gaucher disease. D. Thalassemia major. Correct answer, C. Gaucher disease. Explanation. Gaucher disease is the most common lysosomal storage disorder caused by a deficiency in the enzyme glucose cerebrosidase. This leads to accumulation of glucose cerebroside in macrophages, particularly in the liver, spleen, and bone marrow. Key clinical features: hepatosplenomegaly, pancytopenia, anemia, thrombocytopenia, bone pain, fractures, osteopenia, and Erlenmeyer flask deformity. Delayed growth and puberty, Gaucher cells, lipid-laden macrophages with a crumpled tissue paper cytoplasm. Inheritance and population risk, autosomal recessive, most common in Ashkenazi Jewish population. Diagnosis: low glucocerebrosidase activity in leukocytes, genetic testing for GBA gene mutations. Bone marrow biopsy shows Gaucher cells. Treatment: enzyme replacement therapy, imiglucerase, velaglucerase alpha, substrate reduction therapy, SRT in some types, supportive, blood transfusions, orthopedic care, splenectomy in severe cases. Why not the others? A. Niemann-Pick disease also has hepatosplenomegaly but includes neurological decline and cherry red macula. B. Acute lymphoblastic leukemia presents with pancytopenia but lacks bone deformities and Gaucher cells. D. Thalassemia major causes anemia and bone changes, but no hepatosplenomegaly with tissue paper-like macrophages. Would you like this converted